Good afternoon. I'm pleased to introduce Christophe Chardot, who is the surgical director of our liver intestinal transplant group in Necker Hospital, Paris.
And I'm happy to introduce Dominique Debray, who is the medical director of the pediatric liver unit at Hôpital Necker, Paris. Dominique, could you explain which has been the French government lockdown policy?
Well, yes, as in most European countries, with the increasing number of COVID-19 positive patients, initially in the eastern part of France, where the first clusters were identified, moving quickly to Paris and the surroundings, Île-de-France, France imposed a near total lockdown on March 17, 2020. This confinement translated into banning of any outside friendly, family, or professional meetings. Stores, except grocery stores, were all closed, as schools, universities, theaters, museums, hotels, cinemas, and restaurants. Stay home. We should all stay home, meaning also work as possible at home. We needed a signed authorization from our employer to go to work, and we also needed to sign an authorization form to go out to the grocery store or for a jog in the evening, 1 hour maximum per day. This was applied also to physicians in our hospital. All meetings were held via Skype or other app. Has the hospital activity changed to adjust to the pandemic?
So basically, there was a reduction of the people present in the hospital. And first, all outpatient clinics were converted as much as possible to teleconsultations to avoid unnecessary that patients come unnecessarily to the hospital. Second, non-urgent hospital admissions and non-urgent operations were postponed. Of course, barrier measures were mandatory in the hospital. And fourth, as the coronavirus epidemics mainly concern the adult population and less the pediatric population, the pediatric teams went to help the adult teams, and in some instances, some units like ICU were converted from pediatric to adult ICUs. Dominique, can you please tell us more about pediatric activity? How has it been affected by the epidemics?
Well, Christophe, as you previously said, our pediatric, specifically hepatology activity has been very much affected. Most pediatric wards had to close beds, and most caregivers in these units had to give help to adult departments. Therefore, we had to cancel non-urgent hospitalizations and non-urgent outpatient follow-up. Only emergencies, of course, were hospitalized. And in all, I think that we have canceled more than 150 endoscopies and more than 100 hospitalizations within 2 months. Which has been the decisions about donation and transplant program at Necker Hospital?
National rules were given by the French Donation and Transplantation Agency called Agence de la Biomédecine, and we followed the national rules. These rules were for adults to allow heart and liver transplantations and to stop the kidney transplantations. And for children, the rules were to continue all transplants because the pediatric grafts are rare. Regarding organ donation, of course, it continued, and every donor and every recipient at the time of transplantation were tested for the coronavirus.
How pediatric transplant has been affected by these changes, more specifically?
So, the pediatric transplantation continued. There were less deceased donors, and so in parallel we had more living-related donations, especially for the liver, as we had less deceased donors and we still had urgent patients. We had to do more living-related donors. How did you manage the outpatient care for pediatric transplanted patients?
Well, we organized tele or visio consultations for all patients. Prescriptions for biochemical tests, if needed, were sent ahead of the teleconsultation. And whenever needed, of course, the child was seen in the outpatient clinic. And everything was very, very well organized in our department to prevent any contact between patients in the outpatient clinics, between families. Masks were provided. But this is common practice in our hospital to ask transplanted patients to wear a mask once they are in the hospital. In your opinion, what are the main issues that may arise in the short term due to these both in transplanted or waiting list children?
Regarding the patients waiting for a transplantation, I think in children there has been a decrease of deceased donor grafts. Fortunately, in children, it's relatively easy to propose living-related donation, and so far we did not have patients dying on the waiting list. Regarding the transplanted patients, of course, everybody is afraid of the possible consequences of coronavirus in an immunosuppressed patient. Fortunately, we had some encouraging news coming from Italy and other countries indicating that in liver transplanted patients it seems that there is no over-risk as compared to non-transplanted patients. It might be different in patients who receive heavier immunosuppression, like kidney patients or intestinal patients. So we are afraid of that, of course. Which special measures should be put in place to prevent coronavirus disease in these patients?
Well, Christophe, as you just said, most families are very, very anxious of even coming to the hospital for visits or having their child going back to school. As you say, you know, in France, since the mid-May, schools are reopening. And we, as a group, as a team, but also as a country with other pediatric liver transplant groups, we decided that there shouldn't be any specific recommendation for this specific population of liver transplanted children, and that they should go and return to school as recommended and following the recommendations of the general population. Because there, of course, as you said, there is no increase or demonstrated increased risk of severe infection in the pediatric liver transplant population.